Hello there. My name's Matt, and I am a current third year student at the Idaho State University College of Pharmacy and a member of the Rokai Honor Society. Today I'd like to talk to you about gratitude in your attitude. This was a topic that was requested by some of the students when we sent our survey out a few months ago, and frankly, I thought it would be a fun topic to talk about. It's something that I have tried to instill in my daily life, and so I'm going to give you guys some studies and some of my personal opinion when it comes to things you can do to help yourself be a little bit more thankful. So, first things first, I would like to kind of state my disclaimer here. I'm not an expert. I don't have any special training. I'm not a life coach. I'm not a therapist, although I guess technically after this presentation I could call myself a life coach, right? I mean, I don't have really any exact credentials for this kind of thing, but I digress. My other point here is that I'm teaching from two perspectives. I teach from one side where, it's something I feel I've succeeded in and I can help you get there, or it's an area that I feel I have not succeeded in, and I'm hoping to help you avoid some of the pitfalls I've experienced. So let's go ahead and get started. First things first, I'm going to talk about some definitions just so that we have more of a foundation to base this discussion off of. So gratitude. It is a noun that means the quality of being thankful, readiness to show appreciation for and to return kindness. Attitude is a settled way of thinking or feeling about someone or something, typically one that is reflected in a person's behavior. So you could say the main point of this presentation is to talk about being able to instill gratitude as part of your personality so that it is second nature to immediately think about that as opposed to other things like selfishness, or why me, or this is bad, why is this so bad, things like that. And I'll talk a little more about that later. But first, I'd like to throw out some objective information, if you'd like to call it that. This particular subject is a little bit more difficult because gratitude and positivity and things of that nature are by nature subjective feelings and perceptions, right? Which makes it a little bit more difficult to talk about. But I did my best. I did a couple quick PubMed searches, did a little bit of research, and I'm going to kind of fly through these a little quickly. I have the titles and I have my references at the end of the presentation, so if you'd like, please go look these up, read them for yourself, and you'll probably pull a little more out of them than I did, I'd hope. But the first presentation I'd like to talk about was called Positive Psychology and Gratitude Interventions, a Randomized Clinical Trial. The purpose was to assess the affect of a gratitude intervention on a community sample of adults in relation to well-being and mental health. And remember, affect is essentially described as your emotional state. In this case, they're talking about more negative emotions. If you lack affect, as some patients might in certain disease states, such as schizophrenia is a good example, that means you lack the ability to feel emotion. So just keep that in mind. I realize affect is not something that we hear super often. So there were 1,337 participants and only 410 were actually analyzed. They used a list writing activity for gratitude, neutral events, and hassles groups. So what did these groups mean? Well, the list writing activity given to the gratitude group was to list 5 things every day that they were thankful for. Pretty simple, right? Neutral events was simply to list 5 things in their day that affected them in some way. And lastly, the hassles group was asked to list 5 things that they considered hassles or annoying situations they had to face. The results showed reduced negative affect, reduced depression, greater positive affect, life satisfaction, and subjective happiness in the gratitude group. So essentially, they felt less of the negative emotions, more of the positive ones. And in general, I would assume that they would have a little bit more positive outlook on life. And this is just one situation, if you will, that kind of shows the benefits of gratitude in your attitude. Some of the most notable limitations of this study were self performed online intervention. So you did it yourself, there wasn't anyone telling you to do it, right? Which meant you had to be disciplined. And if you weren't disciplined and didn't do it, they kicked you out of the study, which is part of the reason for the incredibly high dropout rate, which was another weakness of this study. Lastly, because it was online and you were doing a list writing activity, you had to know what you were making a list of, right? Which meant blinding was impossible. So makes things a little bit more difficult. The next study I found was called The Effects of Optimism and Gratitude on Adherence Functioning and Mental Health Following an Acute Coronary Syndrome. I thought this might apply a little bit more to us in the medical profession simply because it was involving patients who have had to deal with a not fun situation. This study examined the effects of optimism and gratitude on self-reported health behavior adherence, physical functioning, and emotional well-being after an acute coronary syndrome. There were 156 patients that were examined for associations between optimism and gratitude and outcomes such as adherence, physical functioning, depressive symptoms, and anxiety. Optimism and gratitude were measured at 2 weeks post ACS and were associated with higher self-reported adherence and improved emotional well-being 6 months later, independent of negative emotional states. They were examined at 2 weeks and 6 months, and this was a little bit difficult. So limitations on this one were that it was an observational study. There was a very small sample size. 156 patients isn't a lot. And it was a non-generalizable population. That meaning there were mostly white males in this study, and they were all from one academic institution. These results were self-reported, which is also a huge limitation because it's all about subjective perception, right? This is a hard topic to study because by its nature, it is subjective. That positivity and optimism, right? So designing a good study to measure this is incredibly difficult in my personal opinion. So there were some other factors that were not included that might have made the study a little bit more difficult. One of which being pro-social behavior and perceived social support. So you would think that someone who has more social support at home would just in general be a little more optimistic. And then pro-social behavior is those behaviors that are just focused on helping other people, as far as I understood it from what the study had said. So walking old ladies across the street. Basically, behaviors that put others before yourself. Pro-social. And then lastly, when reading through this, the methods were incredibly convoluted and very difficult to understand, so I wasn't exactly sure how they came to what they did, like how the methods they used pushed this idea, which made it, probably doesn't make it the best study, but again, it's a difficult subject, right? But those are the two studies I found. So here are some of my personal tips. Make a conscious effort to be grateful. You got to develop that habit to try and be thankful for things and try not to think about the bad. So have that knee-jerk reaction be thank you. You have to try and find those silver linings, even if it seems like the worst day, week, month, or even your year. And yes, that is a Friends reference for those of you who know what that show is, and if you don't, go watch it. It's awesome. Try to find just one positive in each bad experience, even if it's just that it could have been worse. Really good example here. You see this scar? This scar right there? Yeah, that was a wonderful experience for me. And no, I'm not being sarcastic. To be honest with you, first things I thought about when it happened, could have lost my eye if it just been an inch higher. I could have been in a lot more pain. To be honest with you, I did not feel anything in terms of pain. until the stitches were pulled out. So that right there is a silver lining. So it's things like that. And that was the first thing I jumped to, which I know it's a little hard to believe, but that's really what happened. It happened on Christmas Eve night. I ran into the trunk of a hatchback, and the first thing I did was I didn't want to make anyone worry, so of course I joked about it. But honestly, I was incredibly thankful for the way it all turned out. The emergency room people were incredibly nice. The doctor was awesome. He stitched up my face real good, so everything matched up pretty well. And now I got a cool scar, right? And it's things like that. It's being able to take a situation like that and find all those positives and not think about, man, I messed up my Christmas Eve because I ran into a car, or man, my family, whatever. The idea is just trying to find those good situations that happen out of it. And I got a lot of laughs, honestly, too. So being able to think outside yourself, empathy is incredibly important when it comes to trying to be more gracious and trying to be thankful. We have a unique opportunity here, and sometimes it's good to think about, not for the sake of being thankful that you're not in a bad situation, but just being thankful you're in the situation you're in personally. I mean, when you look at it, there are a lot of other places that aren't in as good a situation as we are right now, whether it be countries, people. I mean, even in the US, there are a lot of people who are in worse situations than we as pharmacy students are. And it's not just pharmacy students, anybody in college should be very thankful for the opportunity to even go to college. And that's incredibly important. I had a note about the self-fulfilling prophecy, and I'm going to turn it on its head a little bit. The self-fulfilling prophecy is the idea that if you continue to focus on bad, you're going to make bad come about, right? Well, I don't find that to be entirely true. I think more what happens is that when a situation goes wrong or you have a bad situation, the people who talk about the self-fulfilling prophecy are those that are already focusing on the bad. So that's what they look for, right? You have something bad happen. Let's say you were getting a car accident. And you're like, oh, look, the front of my car's messed up. This has happened. This is bad. This is going on. And then you get home and something else has gone wrong. And the first thing you do is, crap, well, I got in that car accident today. This happened. This happened. Now I come home and this is what went wrong. The idea is that you're looking for that, right? That's not. And I feel like that's what perpetuates this self-fulfilling prophecies that you're looking for. It's not that anything changed because you were frustrated and you're thinking about the bad thing. It's because that's what you're looking for. Let's say you got in that same car accident. And you're like, man, I'm thankful I'm not in the hospital right now. Man, I'm thankful there's not more damage to my car. It could have been totaled. It just changes your whole outlook. And that's what's important. So, lastly, I had just a couple of tips for how you can kind of start to shift your brain to develop that habit of just being thankful. First things first, make a list of things that you are grateful for. If you can do it every day, do it, but you don't have to. And if you keep a journal, try and write some things you're thankful for in there. And then just try to say thank you more often, even for the little things. I know at my household, I try and thank my wife for just about everything she does because she doesn't have to do it. There's no obligation. I do not expect her to do anything she does around the house. But she still does it, and I make sure to try and thank her for every last bit of it, even if it's just something as silly as picking up my socks off the floor. And that habit has become, I'd like to think, ingrained in me. I try and say thank you a lot for the most minimal of things. And that's, in my opinion, what will really help. So, with that being said, here are my references to the 2 studies I mentioned earlier. If you have any questions, please email us at rokai@isu.edu. Thanks for watching. I really hope this helps. And if you really liked this, shoot us an email and tell us you did, because we can continue to do more topics like this. Again, thank you for your time, and I hope you have a wonderful day.